We're pleased to have all these wonderful panelists talking about federal funding of kinship services in action around the country. So you're really hear from people who are accessing these funds and putting them to great use on behalf of kinship and grandfamilies, by which we mean grandparents and other relatives and close family friends who raise children when parents can't. Well, if you'll go to the next slide, I'll tell people a little bit about the Grandfamilies and Kinship Support Network here at Generations United. If you haven't joined us on one of these webinars before, we are the only technical assistance center on the families that is federally funded ourselves, thanks to a cooperative agreement with the U.S. Administration for Community Living. And our mandate is to provide technical assistance to the array of services that impact the families. Because we know they don't have just one system that impacts them. And many times these systems don't have services directly about kinship families or talk specifically about kinship families. They might talk about families, and grandma or auntie may not see themselves in that language. So that is our mandate, to get systems to work better together and serve the families better. So we are here for you as service providers to provide any free of charge assistance that you may need. And you will see that on the next slide. Amongst the things we do are webinars like this. We also have learning communities that we host around a variety of subjects. We had a very robust one earlier this year on kin finding for child welfare agencies, but we've also had them on an array of subjects. As I said, we respond to individual requests for assistance, and we have two phenomenal technical assistance specialists and fabulous subject matter experts like Stephen Olander here, who can respond to your requests. So they can be simple, or they can be more complex and require a meeting or a training. So don't hesitate to reach out. And then we have a very comprehensive website with over 100 original resources that we've created with our partners and subject matter experts in the last 4 years. So on the next slide, you will see an image of our website and the URL for our website. So please visit it. You do not have to put any information in order to access all our resources. And you can see there in the top right where you can press a button and request assistance. And either Shayla or Kylie, our technical assistance specialist, will get back to you very soon. On the next slide, we will all see our fabulous presenters today. I'm so thrilled. Stephen Olander, who is our subject matter expert, one of our subject matter experts, has pulled this fabulous panel together. Many friends and new faces too. So we have Rachel Kinder, who joins us from who joins us from Mission, West Virginia, and she's the Frameworks Director there. Thank you, Rachel, for joining us. Danny Martin, all the way from Larimer County, well, all the way for us, because we're in Washington, D.C., Larimer County Office on Aging in Colorado, and she's, working with her is Mark Sleater, who is also there in Colorado. Shelley Willis, who runs a fabulous family resource center, kinship navigator program, just about everything else down in Washington State, known as the Family Education Support Services. And then Jackie Payne, who is the managing attorney at the longstanding Kinship Care Project at Atlanta Legal Aid, a true exemplary kinship program that we have designated as such. So a pleasure to welcome you all, and thank you so much for joining, for sharing your experiences and expertise with us. We now want to know a little bit about you. So Ro is going to launch a poll and just ask you a little bit about the federal funding you have been able to access, if you have been able to access, so we can kind of tailor what we discuss, as you're going to hear from all these fabulous people. So we'll just wait here until we get kind of a critical mass of responses, and then Ro will close it out, and it'll be my pleasure to turn the webinar over to Stephen. Thank you for participating. It's always useful to know who's been able to get what and how we can help. There's a lot to read, so we'll give it a minute. Looks like a lot of people from all over the country are with us today. Thank you for joining us. More than half have participated now, Stephen, but let's give it a few more seconds. It's a lot of choices.
Great. Yeah.
I realized as I don't know, with time, my reading comprehension is slowing down and getting less accurate too, by the way. But maybe that's too much information about myself.
We love it. We love hearing it all.
Look at this, Indiana, North Dakota, Texas. This is great. I think it's slowed down. You could probably close it now, Rowan. If you haven't had a chance to participate and want to say something else, you could stick it in the chat. We'd love to see it. So I will turn it over to you now, Stephen.
Great. Looking at this, it looks like we're getting a great group of people with a wide array of different federal funding services, as well as a number of people who have not had any not applied for funding at all. So I think that the great thing about today's panel is that we'll be hearing from a wide variety of organizations with a wide variety of different funding services that they've accessed in different ways. So really excited to be here with all of you and to see this. And we're seeing a lot of direct child welfare funding of people who responded to the survey, which is great. We are really excited to see that, and we're also really excited to talk about those pieces and also other sources of federal funding as we think about diversifying there. Hi, everybody. As Anna mentioned, I am Stephen Olander. I'm a subject matter expert for the Grandfamilies Kinship Support Network, where I focus on issues that are related to federal kinship policy. Looking at the participants list today, I see a lot of familiar faces, which is really great. I know many of you from different roles that I hold in the space. I'll disclaimer first to say that I am here as a representative of the GKS network. And only as that, but I'm here today to talk with you about federal funding for kinship services, because one of the things that I was really fortunate to be able to do on behalf of the network was to be the primary researcher and author for this resource that we released last year, Funding Kinship Services, a federal primer on federal funding sources. Ro, if we could go to the next slide. The primer is meant to be a resource for organizations and for agencies that are serving kin to help them understand and access all of the various different options for federal funding. The purpose of that is that it provides basic information on 45 different federal programs that can be used to finance kinship services. That's a comprehensive list, but it is certainly not an exhaustive list. So there are many more sources that are out there. And for each of those, it gives a kind of high-level overview that's meant to help point you in the right direction so that you can do further research and you can decide if different sources are a right fit for you and your agency. If we go to the next slide, we'll talk a little bit about what's in the primer. As you can see on the right side of the slide, that's one of the entries that is there. As you can see, it is beautifully designed. That's how you can tell that I did not design it. What I delivered to Anna was a 120-page Word document in size 11 Garamond. But it's laid out on the website, broken out by the different types of funding, different searchable ways for that. For each one, we have an overview, information on services that are eligible and how those funds are distributed, as well as some links to point you in the right direction. And where we had them, examples of that funding being used, and different advice for organizations. I think we can take down the slides here and go into the regular conversation. So the primer is meant to be a resource for all of you. But we know that the prospect of approaching federal funding can be daunting. And there's a lot of information that can be gleaned from the primer. But there's also only so much that one can get from reading something like that. And so what we have for you today is a chance to hear from real experts, people who have done this and accessed a variety of different federal funding sources, as I said before, in a variety of different ways, in order to support a wide variety of different programs that serve kin. as I was preparing to moderate today's discussion, I got to learn so much from them. So I'm really excited to be able to give them a chance to share their wisdom with you. Um, Before we begin, I just want to name an elephant in the room, which is that it's a strange time to be talking about federal funding because a lot is shifting in this landscape. And some of the questions that we got in the registration were about how to move through that shift. At the same time that federal funding is shifting, we know that state budgets are shifting and philanthropy is shifting. And so many organizations are out here beginning to look at federal funding in a different way, thinking about it as a way to diversify their funding streams, to make sure that they're able to do this, they're continue to do their work well in this shifting landscape. And so as organizations are considering those options, we thought it was important for you to have all of the information at your fingertips. And we thought it was a great time for us to be talking about federal funding. Without further ado, we can turn now to our panel. And I want to start off by asking each of you panelists to introduce yourselves and to share a little bit about your organizations, the federal funding sources that you use, and the programs that you're able to do to support your work with kin because of it. If I could go to Jackie first. Jackie, can you introduce yourself and your organization?
Sure, Stephen. Thank you. I'm Jackie Payne. I am managing attorney of the Kinship Care Project at Atlanta Legal Aid. I like to think of us as a large civil nonprofit law firm, which is what we are. Our Kinship Project is a smaller part of that, but provides a ton of service. I have worked with legal aid for the last 43 years. A lot of that time has been spent doing kinship cases and then helping to set up what we initially called our Grandparents Project back in the early 90s, late 18, not 1889, 1989, let's go with that. I'm not that old. And from there, we have reformulated and re-envisioned ourselves. So now we are the Kinship Project. And about 10 years ago, we had at Legal Aid, we've always used VOCA funds because we have protected women who are and children who have been victims of domestic violence. But looking at the definition of VOCA, it suddenly snapped in our heads that, wait a minute, kinship families can fall under how VOCA is defined. So we did an application. Our kinship funds, yes, sorry, I said I wouldn't use the acronyms. I see Anna just explained. VOCA is Victims of Crime Act. But ours in Georgia is done through our CJCC, which is our Criminal Justice Coordinating Council. So it's sort of the trickle down effect. So the VOCA is of large federal funds that trickles down to the state for the CJCC funding. And then from the CJCC funding, it goes to the individual programs. And so we provide direct services. We represent folks in all kinds of cases.
Terrific. Thank you, Jackie. Why don't we jump over to Rachel next?
Hi, I'm Rachel Kinder, and I direct a program called Frameworks as part of Mission West Virginia. Mission West Virginia has been around since 1997. We were founded with leftover campaign funds from a governor's run for office. Governor Underwood had the distinction of being the youngest and then later the oldest governor in West Virginia. And at the end of that second campaign, he used those funds to found a nonprofit. We've done a lot of different things over the years. Currently, we operate two main programs. One of them is called THINK, which stands for Teaching Health Instead of Nagging Kids. They are primarily federally funded to do teen pregnancy prevention and healthy relationship education. And that name, I believe, was voted on. It was a contest among school youth. So that's where that name came from. They've done a lot to reduce the teen pregnancy rate in West Virginia, which we're really proud of them. And then the Frameworks program, which I direct, is a little bit of state funding and private foundation funding. Primarily, we do foster parent recruitment under contract with the Department of Human Services. We operate a newly scaled Wendy's Wonderful Kids program. We have a program called The Bridge, which works with youth who are in high school to achieve graduation and academic achievements. We have an over 95% graduation rate with The Bridge, and about 70% of those youth are in kinship placements, whether formal or informal. And prior to the Kinship Navigator official funding, we operated a Relatives as Parents program, which was funded by the Bureau of Senior Services. We spent many years operating that just on a shoestring budget with a part-time person until about 2019 when we started a formal Kinship Navigator program.
Terrific. Thank you. Thank you. We'll go next over to Shelley.
Good afternoon. Shelley Willis, Executive Director of Family Education and Support Services, or FES. We often say FES up, where we serve over 28,000 people every year through our 3 family resource centers located in Washington State. We provide a wide array of evidence-based programs, anywhere from home visitation programs for women who are pregnant and impacted by substance use to our kinship programs, often the caregivers caring for the kids of those women, and all in an effort to ensure healthy child development. We fund this work through a mix of federal, state, private foundation, and local support fiscal streams, and that includes direct federal funding and contracts and grants, and also braided funding through our collaboration with state agencies like Title IV-E through child welfare or the Family Caregiver Support Funds. We collaborate with the area agencies on aging in providing. Those offer everything from parent education to case management. We call that navigation and research studies. It's helped us to capture data on the needs and impact of the services that we provide, and also to implement new emerging issues, services. So legal support, respite care, emergent financial aid, or concrete supports, housing, food, and all the things kids need to do when they enter into relative care, like go to school. We had one grandparent who drove her kid to and from school every day for 6 months until we were able to get her connected to McKinney-Vento and a busing system. So all kinds of funding helping us to do all kinds of services. I've learned that the lasting impact takes more than just one funding source. We need partnerships, creativity, and a willingness to blend resources to meet the needs of all the families that we serve. Happy to be here today.
Wonderful. Thank you. And last for this, we'll go over to Mark and Danny.
Good afternoon, everyone. My name is Mark Sleater, and I work in the Larimer County Office on Aging, which is the area agency on aging for our county, and specifically work with Danny in the Family Caregiver Support Program. And I'm going to hand it over to Danny, and she'll give you a little bit more detail about our program.
Yeah, thanks, Mark. My name's Danny Martin. Again, like Mark said, we're in Colorado in Larimer County Office on Aging, specifically in the Family Caregiver Support Program. So we support caregivers of the whole span of life. So we support caregivers caring for an older adult, but we also support grandfamilies. So we have 4 different parts of our Family Caregiver Support Program. The first is a respite voucher program. We have a respite voucher both for people who are caring for an older adult and for grandfamilies raising their grandchildren. So that's a little bit of financial assistance that we can allocate to families so that they can pay somebody else or an organization to take care of the child so they can get that much needed respite or break. So it can cover things like a day camp or after school program, babysitting, things like that. And we'll get more in depth with our voucher program a little bit later. We also do caregiver consultations with caregivers, so we can meet them at their home or in the community on the phone. We're really flexible about meeting caregivers where they're at, connecting them with local resources in our county. We also offer 2 evidence-based classes for caregivers throughout the year. So we have Powerful Tools for Caregivers, and we have Stress Busting as our 2 classes. And then the last piece is we offer caregiver events throughout the year. We try to do 3 to 4 events specifically for caregivers, really with the goal to just connect them to one another and help them build a village. So the main purpose is really just getting people together, doing something fun. We did like a painting class one time. We did a pottery class. We're going to go pick some apples in the fall and really just getting caregivers to connect with one another. So thank you for having us. We're happy to be here.
Thank you so much for being here. I hope that all of you for participants understand why I'm so excited to have such an amazing panel here today. They're really doing remarkable work and have a lot to share. So I want to dive right into that to make sure that we are getting the most of their time and the time that we have today. First, we'll dive in. We know that choosing to pursue federal funding can be a large and a daunting task. So we want to talk a little bit about the decision to pursue federal funding and also the decision of what funding to pursue. So I want to start with Shelley. I know that FES has pursued and utilized a number of different federal funding streams to support your work with families in different ways. How do you decide what to pursue and how to go about that?
That's a great question. I wish I knew 20 years ago what I know today. And really, I have to say thank you to Generations United, because they really are a great resource to help guide you through this. I hope you lean on them. At FES, we pursued several different federal funding streams over the years to decide how to support us. Every single service we offer was born out of a community need. When we ask our community, we listen, and then we create the plan to address whatever the issues are. For example, before launching our Adulting 101, we asked youth, what do they need? And for our dads program, we asked fathers, what do they need? And for kinship caregivers, we worked with our state partners and were able to send out a survey across our state asking relative caregivers, what are the barriers? What are the issues that they're facing? And we were able to get a great idea of not only how many caregivers there were in the state, but what their real needs were and the barriers preventing them. So that survey that we sent out in 2002 really gave us insight into the greatest need, which was support and help navigating systems, whether it was court or TANF welfare or legal. There really wasn't any support for relative caregivers in our state. There was for foster parents, but not relative caregivers. So we were able to document the need, begin to strategize a plan on how to address that need and the gaps in services. And then we looked at funders. And we listened, we responded, and then funders. It's not always easy to go for federal funding because there's a lot of rules you have to jump through, but it is a very rock solid support when you can secure that. Sometimes we looked for funding to expand our program, and that wasn't a direct contract with us, but would have been a collaboration with a state entity like Title IV-E funding or the Family Caregiver Support Funds. We also consider practical factors like timelines, reporting requirements, and for smaller organizations like mine, do we have the infrastructure to really capture the data and respond back? So not only can we get access to funds, would we be likely to be awarded it, but can we internally manage the capacity to respond to that need? Opportunity versus capacity. In short, the decision to pursue federal funding is never about chasing the money. It's about matching the funding to a real community need, our mission, and our agency's ability to sustain the funding so we can truly support the families over the long term.
I love that. That's amazing to have. And you know, we'll talk a little bit more later also specifically about that kind of capacity piece with federal funding, because we know that it's different. I want to turn next over to Mark and Danny. You know, as a area agency on aging, you have a slightly different process here. Can you talk to us a little bit about your relationship with federal funding and how your agency approaches this?
Yeah, so since we're the area agency on aging, we don't necessarily have to like identify and seek out the funding in a sense. The funds that we utilize are Title III caregiver funds. So the State Union on Aging in Colorado, they oversee programs funded by the Federal Older Americans Act, as well as state funding for senior services. And so the State Union on Aging provides assistance and funding to the 16 area agencies on aging throughout Colorado, which we're one of them. And then we provide community-based services to people over 60 as well as older, 60 years or older, as well as caregivers. And then so within that caregiver category, we're able to serve grandfamilies as well. So in Colorado, the Older American Act is funds are distributed to the area agencies on aging based upon a formula that considers various things, kind of looking at things like a number of older adults in the county that we reside in, whether they live in a rural setting or not, minority status, income level, and then specifically if residents are over the age of 75. So that formula that the State Union on Aging uses helps determine how much funding each of the counties receive. And so they're used in various aspects of our program. So the two main areas where we use this funding is for our respite voucher programs, which has been amazing. And historically, our area agency on aging has just provided respite vouchers for adults that are 60 and above who are caring for someone. And back in 2022, we were just hearing a lot of feedback from a number of our partner agencies, community agencies that we connect with, of the increased needs in the area for kinship support. And so we were able to develop the Grandfamily Respite Voucher to help address some of those needs. So this particular voucher allows us to provide funds to grandfamily caregivers for things, as Danny mentioned, after school programming, school sports participation fees, camp fees like sports camps and things like that. And then there's also a number of organizations in our county that provide actual respite to kinship families, where these funds can be used to pay for some of that participation as well.
Terrific. Thank you. I'll turn next over to Jackie. We know that it's not unusual for legal aid programs to use VOCA funds, Victims of Crime Act funds for people. We're trying not to use too many acronyms, but choosing to target those funds to create legal advocacy for kinship is not the norm. Can you talk a little bit about your decision-making process in this?
Sure. We actually did a whole logic model to kind of figure out what we could do and how we could do it. And so, of course, our main goal is to be able to provide direct legal services to more folks than we have been able to do before we got that funding, and to support the project itself. And we actually have a combined grant program. So we have them funding through the CJCC for the VOCA Victims of Crime Act funds. Then we also get funds from our Supreme Court Commission because we have some folks who have been touched by either being foster parents or encountering foster parents in their role as legislators or judges, and they wanted to support the program. So between those, we've been able to truly expand our services. The biggest thing, of course, is that if we were only using the LSC funds or the Legal Services Corporation funds that we all get as legal service offices, we could only go up to 125% of the federal poverty guidelines. But with the VOCA funding and the AOA funding, we're able to go up to 200% of the federal poverty lines. So that certainly opens up the gates to a lot more folks who can be eligible to ask us to represent them in a guardianship case or a custody case or an adoption, who wouldn't otherwise qualify for free services. So it's been pretty amazing. We've seen an increase in staff because when I came back, and I'll say came back, I never left legal aid, but I went to another office. When I came back down to our main office, though, to reformulate the kinship project, it was me, one other attorney, and one admin staff. And we've now grown to 4 attorneys in addition to me, and 2 admin staff. And we recently hired a navigator, sort of social work person to help with the resources, because we try so hard to be a holistic law firm. But sometimes as lawyers, we're kind of busy with the legal part of it. And so we don't get around to helping folks put in their TANF applications. They're making sure they're getting the right amount of SNAP benefits, or even looking at housing problems because an elderly person is living in senior housing. Now they have, the largest amount, I think, was six grandkids with them in their little one-bedroom senior housing apartment. So to kind of help people deal with those resources, identify some other things that they'd be able to do, we have added that staff person. So I love the work that we've been able to do because of our VOCA funding. And I love the expansion that we've been able to make, kind of beyond just direct legal services, but the other things that we do.
Fantastic. And I think such a great point also in there about, with the different funding sources, you're able to expand the population, not just the amount of people, but the specific populations that are able. It's a great thing to be thinking about. Thank you. Last on this question, I want to go over to Rachel. Rachel, you've built at Mission West Virginia. You've built programs receiving federal funding through different intermediaries, the Child Welfare Agency and the Public Defender Services. Can you share a bit about your decision-making process and how you came to build programs in that way?
Yeah, I'm happy to. It's actually pretty entertaining to look back on in hindsight. Back in 2008, we actually applied for one of the federal Kinship Navigator grants. We did not know what we were doing. We were doing what Shelley just said not to do. We were chasing the money, and the federal reviewers said, "Nice try." And it was not a good application. So in 2019, we were approached by the Department of Human Services. At that point, we had been a grantee with the department for close to 20 years, and my grant manager reached out and said, "Hey, West Virginia can access this 4B funding. I want to serve these kinship, I want a kinship navigator program. I want to work with you guys to build it. I think we can hire 4 people." My director and I had a slightly heated conversation where I said, "Oh my gosh, you're going to give me 4 staff in a brand new program, and I don't have the infrastructure for this." And we politely argued, and I cried a little bit. And then we went to the meeting at the state office and sat at our grant manager's desk and kind of combined the problems that were crossing her desk at the state level of DOHS, and then the problems that were crossing our desk as a nonprofit that a lot of people just find us. We have high Google rankings. A lot of people find us with their questions. We combined that knowledge. We designed a program, and we're able to access those funds at the end of 2019, right before COVID hit. So we had 4 new staff, a brand new program, and a state shutdown. And we spent the first couple of months calling kinship families, doing COVID surveys and seeing how prepared people were, and just doing all sorts of unexpected things. And then got our program going with 4 navigators serving families statewide. The program was designed to serve families that had newly taken kids into their care, kids that had newly entered state custody. And then in about 2024, we were approached by the Public Defender Services, who wanted us to apply for some 4E funding. And at that point, we were not trying to grow Kinship Navigator. We were trying to grow a different program, and we did not think that was a good fit. They asked us about 3 times, said, "No, we really think you guys are a good fit. We'd like to try this out." And at that point, it was my turn to say, "Actually, let's grow the Kinship Navigator program. I think that is a fit. I need a manager." And we worked with the PDS office, and I was able to add a navigator and a manager. And that has been a game changer. And that has actually enabled us to do a lot of program development that we just did not have the capacity for with 4 navigators.
That's wonderful. May we all be in the position where people are trying to offer us money that we're saying, "No, no, please, we can't have that right now." That I think is a really great segue into the next step of the process of what it's like to get federal funding. And I know Mark spoke a little bit about that for Larimer County, so we won't go to them. But we'll go first to Rachel here. Can you describe a little bit of the kind of process of what it's like to actually get federal funding, the internal planning, the application process for that?
So that piece was actually a pretty familiar role to us as someone who had worked with the Department of Human Services for so many years. So we were working with grant managers we'd worked with before, and just kind of designing what the needs were in West Virginia and how they fit in with the program guidelines, with the 4B guidelines. And it really wasn't too difficult. And we work pretty hand in hand with the department every year to reapply and every year to submit their reports and all of that. We have reformulated our tracking a lot over the years, so that we have better numbers, because we started with a blank slate, with no materials, just kind of designing the program from the ground up. And then again, with the 4E funding, we've worked with Public Defender Services to develop grant reporting for that. And it's slightly different tracking, but it's all the same program. So just kind of tracking different elements that meet the needs of the two different funding sources. We've been really lucky to have two great partners that understand the value of our work and the details of our work, so that we can do what needs to be done for the families and still track what is needed for the funding.
Great. Shelley, how about you? What was your process of applying for these funds and getting them?
Okay, so for us, applying for federal grants is never a one-size-fits-all process. It really depends on the funding stream. Because we braid federal, state, and local dollars, each has its own unique application process. When we apply directly to federal grants like HHS or DOJ, it's competitive, it's highly structured, and if you've written grants before, you can weave your own information in and out. These are not like that. Strict deadlines, detailed narrative requirements, budget justifications, heavy emphasis on evidence-based models, and often there's rules like you can't subcontract or you have to have a pre-authorized evaluation team, plus font size, paper margins, all kinds of checks and balances that they have in their word size, word count, all of that. They often have specifications to rules that we don't think about in other areas. For instance, they may not cover food or travel. And as a nonprofit, I learned quickly federal grants are not your typical grant applications. We usually spend months preparing, starting with internal planning sessions to clarify our own program design. Like Rachel said, I have cried. I've cried over these grants because it takes so long to put them together. They're like 600 pages long. By the time we have finished, it's like we just gave birth. And then we just hope and pray that the future will be bright. Also, you have to pre-register for these grants on grants.gov and SAM and have a unique identifier. There are prep work you have to complete before you can even apply. Federal grants also have a long review and scoring process, and even though it may be awarded to you, there's a negotiation period before they actually flow. I say that, but last month they dropped a grant for us on a Friday, and we had 8 days to get it in. I mean, yikes. We did it, but we'll be in limbo now until September. So it's just a different political climate right now, and we had to be at the ready. By contrast, when we access federal funding through our state partnerships like Title IV-E or the Family Caregiver Support Funds, that is more typical of an application that we're used to. We can amend our contract. They're often faster. They don't require a lot of pre-authorization, but they do require strong relationships. And that's something we had to start years ago. And both still include strong data collection protocols. I wanted to say something about the blended family funding. While it might combine federal, state foundation, or private dollars into one pot, it is still complicated on making sure you meet every funder's data collection requirements. And the key difference I've seen is direct federal grants demand more lead time, formal structure, and competitive positioning. No matter what the stream, we plan well ahead. We bring partners to the table. We know we're going to have to collect data and anecdotes, and we have to be able to tell the story so that we can work for many, many years in supporting these families. Federal grants tend to give us a core structure we can work from, but we also had to remember you can't match federal funds with federal funds. So you have to think about that too when you're planning your financial story. Thank you.
So super easy, not at all complicated, really easy, just smooth sailing. I'll turn it over to Jackie next. For your work, what was your application process like as you consider this?
It was similar to Shelley's. And we had to actually kind of look at what our cost per case was to figure out, okay, how much of this can we ask for? How much of it can be apportioned to this particular kind of grant? One of the things we did in trying to make that decision, we divided up the attorneys. So when we first got the grant, of course, there were just two of us. So one of us did the VOCA work and the other one did what we call the general work. And so when we did our VOCA application, then most of my time was in a portion to the VOCA cases. We also had to come up with a way to decide how many cases we could handle for the amount of money that we were requesting. And that went back again to the per case cost of handling each case. The other data we kind of looked at was grandparents versus other kinds of relative caregivers. We looked at adoptions versus other forms of establishing a legal relationship for the caregiver. And then also, because Georgia is a pretty large state, we have 159 counties. And so then we had to look at how are we going to serve? Will we be better able to serve all 159 counties? And I think we'll get into a little of that later as far as partnerships go. But that made a difference too, being able to show to the CJCC, our VOCA folks, that we were going to be able to provide some assistance throughout the state. And since we've been awarded the grant, it's been approved again each time the grant period runs. But we have to show, that we have done this number of cases. We've served this many grandparents. We've served this many other relatives. We've served this many non-relatives. The demographics go all the way across. So everything from racial to citizenship versus non-citizenship. Of course, the income amounts, because they've got to be below that 200%. So lots of data that has to be reported, and that's reported quarterly. So yeah, keeps our grants manager pretty busy, but we have so many grants running. It's how we keep our service price so low at zero is because of the grants we've been able to get over the years and to continue. So.
Thank goodness for grants managers and people who are able to manage all of those things. I am not that person, so I'm always very, very glad to have that. Thank you. Moving forward, as has been alluded to by pretty much all of our panelists, we know that the realities of actually having federal funding is different than we see from other different funding sources, be they state and local or private or philanthropic or earned revenue. So what I wanted to ask is, how has federal funding been different from other funding you've received, including those requirements related to capacity and data and compliance? We've touched on this a little bit, but want to hear a little bit more. I'll turn right back to you, Jackie, for that one.
Okay. It's a little bit different, and I think it's more formal, and they do require hard data. I mean, you have to be able to show specific numbers. If you've committed to 600 cases, you have to be able to show that you have completed 600 cases. The other part of that is, of course, we get questions from other folks who may be doing some of the work that we do. Will it cover trainings? Will it cover travel for trainings? Are we able to submit those things as a part of the budget? And that is true. For the federal funding, you can, as long as you can show that it is somehow going to go to assist a victim of crime. So the training you're going to has some relevance to that, then yes, you can use the funds for training even. but we try to make most of ours for direct service. And with doing that, we commit to a certain number of cases, we commit to a certain demographic population. And so quarterly, we have to show that we have in fact done that.
Terrific, thank you. Why don't we go next to Rachel?
So I feel like we have it a lot easier. We're a sub-grantee through the state. So that was a role that we were pretty used to. But also in terms of federal grants, I have an advantage because the Think program has received federal funding, direct federal funding for 17, 18 years now. So I have a director that I can go to for what does this mean? What does that mean? What's allowable? We were very lucky that Kinship Navigator funding was not the first federal funding to come through our agency, and that there's direct federal funding to the Think program. So they had kind of already done that and established a lot of the protocols for that.
That sounds wonderful. Very nice in that. Next, why don't we go over to Shelley? Let us tell us a little bit about how having federal funds is different than other pieces.
Well, cash flow would be one. A typical grantor, I could go to Microsoft or Cambia and we would get this beautiful check for 100,000 and we would say thank you. And we would go do our work and at the end of the year offer a report. Federal funding doesn't work that way. It's often reimbursable and dependent on receipts and other documentation that kind of show your expenditure and may not be as timely as you might think it would be. It's not an instant gratification concept. And you have to have an internal capacity to be able to turn all of that around with solid data practices and the people. I had to build my infrastructure around our fiscal team. If you build those muscles, it pays off, but it does take a while to get there.
Perfect. And then we'll pass over last to Mark and Danny.
Yeah, for our situation related to Title III funding that we received from the Older Americans Act, there's specific guidelines that we're required to follow related to who's eligible for those funds. So things like for our grand family respite voucher, the grandparents or step-grandparent or older adults needs to be a relative caregiver of the child by blood, marriage, or adoption, and they need to be 55 years of age or older. So guidelines related to age, they need to be living with the child and be the primary caregiver, or have a legal relationship to the child through either custody or guardianship. And so there's just a lot of various things that we need to follow related to some of those guidelines. We also need to be careful too in our situation that we're the payer of last resort for these Older American Act funds. Using them for respites and things like that. In our situation, some of the information that we're gathering through our process of referrals is asking folks whether they're connected to the child welfare system, are they receiving some type of stipend through that or not. So it kind of helps us through our process to determine eligibility.
Terrific. That is really helpful. And we know with these grants, there's a lot that we need to report. We make it very easy from a federal government perspective. What I'm hearing from everyone is just how remarkably easy all of this is, and no added complexity on there. I do want to we want to make sure that we are giving we are sorry, I'm losing words right now. We want to make sure that we're keeping the time for this webinar because I want to make sure that we have great time for the Q&A that is coming afterwards. So I want to wind down with just as we're winding down into this, I want to give everyone a chance to reflect a little bit on our process here. About we would love to hear about any lessons learned that you have through your work with this, or put another way, if you were to be able to go back in time to the start of this process, whether that was 2 years ago for funding, whether it is something that you've been doing, Jackie, I think you said for 43 years on this. If you were to be able to go back in time to the start of this whole process, what's a piece of advice that you would give yourself, or a reflection that you would want to be able to share with yourself at the beginning? And with this one, I'll start with Shelley for an answer here.
Okay. One of them is partnerships. You can't match funds with other federal funds. So we really had to go into our community and make sure we had some blended funding that didn't overlap that. And usually when you apply for federal funding, you have 3 categories of letters of support that you have to submit. One is an MOU, and that's not just someone who thinks you're awesome, it's someone who you are collaborating with, and they have committed themselves to support you in a specific, usually financial way. So for example, it was a challenge for us to get volunteers. The federal funding has a very specific cost analysis for volunteers, and we had to incorporate their formula for how much we can count volunteer support. And then we have letters of support from the community who will say, we're not going to provide you a specific service, but we're here to rally and support. We'll send people your way. And then there's testimonials from those that you serve saying, yeah, they do great work and we're really happy to be there. Those are the few that come to my mind. I wish I'd known that earlier on and had built that infrastructure so that I could just grab it when I needed it. Now we have, so good luck working out to the building of the partnerships.
That's great, and always so valuable. We definitely saw that as we were building the primer, a major theme that we saw throughout of those partnerships pieces. I'll go next to Danny and Mark for what were your kind of reflections or lessons learned or advice that you'd give?
Same with Shelley. Partnerships played a really big role as far as a lesson in us launching our Grand Family Respite Voucher. We really needed to lean into our community partners, both statewide and locally. So we met with like 3 different other AAAs, kind of to get a grasp on what they were hearing and seeing that kinship families really needed. We met with our local community partners, definitely leaned into our kinship families themselves and made sure that we were asking them what would be the most helpful for you through this respite voucher. What do you want to see out of it? And giving them surveys after the first round of vouchers to make sure that we were continuously meeting the needs and addressing the gaps that were in our community. Also, I would say a lesson for us was just knowing it takes a little bit of time. For us launching the Grand Family Respite Voucher, I went into it with this expectation that we would have a flood of families applying and it was going to be this big launch. And it really was a slow trickle, which was okay. And I think I just reflecting back, realizing that starting something new takes time. It takes time for word of mouth to get her out. It takes time to communicate this new program to our partners. And so just being patient with the process and sticking true to it, because it has grown a lot over the last 4 or 5 years. So being patient with the process.
That is always so difficult. And from what I'm hearing from everyone, it's also being patient with the federal government through the process, because they're making another layer of patience that we're adding on things. I love that. We'll go over next to Jackie. What are some lessons learned that you had or advice that you would give?
A few things. I'm a big Field of Dreams fan, so if you build it, they will come. We had clients 30 years ago, and we were attempting to serve them just on what we had. And there was no project. We slowly built the project with the support of a really good executive director. We're now with our second executive director, who also is very supportive of our program. But I think we should have looked at funding sources a little earlier, because I won't say it's been easy to find them. It's not like they've just kind of fallen out and fell into our laps. But I think we were too focused on how do we provide the services versus how are we going to pay for this? So, Rachel, in a sense, we did the opposite of what you did. We started doing the work and then went to see, okay, what's out there that can help us pay for the work we're doing. So that I think has been my biggest lesson, my biggest takeaway. We have coordinated with grandparent support groups in the city for years. One of them, Project Healthy Grandparents, was there from the beginning with one of our first cases 25, 26 years ago. So we continue to work with them. We have a lovely MOU where we provide some trainings for them during the year. We also go out and talk to their caregivers about issues they may be having. So there's all of that going on. And then when I think about our partnership with Georgia Legal Services, because for so long we thought of ourselves as just these two separate entities. We've got the folks, if you guys are familiar with Atlanta, we've got the folks who are sort of right at the perimeter or around the perimeter, so the 5-county metro area. And then Georgia Legal Services has the rest of the state. So when you're talking 159 counties, that's a lot of area to have to cover. So we knew that our small version would not be able to cover all of that. So we partnered with Georgia Legal Services, and they work as basically a sub-grantee under our VOCA grant. So, just figuring out better ways to coordinate services and then applying for the money earlier. Those are my two takeaways from things that I wish I'd known 25 years ago. So
Thank you. Thank you. And last, we'll close out on this one with Rachel, and then we'll talk a little bit about moving over to the Q&A. Rachel, what are your big lessons learned and advice that you would give?
I think the biggest lesson coming from a nonprofit is that we really need to embrace our unique role. And it's not necessarily the thing in the case that you see as most important. It is what is something we can do that others can't do. And for us, two of the really things that we did not see coming were we can be a listening ear. We have staff who can listen to grandma vent for an hour or provide some type of emotional support because we have the time to be on the phone with the caregivers. And then the other thing is we can shop online. And we did not write tangible items into our first grant, and we did not foresee that. And it's not even about having the funds, it's about having the ability to make online purchases. Became a very unique role for us in that we can get a bed to a grandma overnight or in 2 days. And it's very, very small amounts of money that can keep these families running and being able to meet the needs of the kids. And just our ability to order online and ship things became a very big part of our program because it's not something that someone else could easily do. So just really embracing what is something we can do that can't be done. And that's our unique piece in it.
I love that. And I love what 2-day shipping as an important final note for things. I think I've learned so much from getting to speak with all of you. And one of the lessons that I've learned is that we really should schedule all of these webinars for being 4 to 5 hours long, because I feel like we could continue to listen to all of you and continue to learn. But I'm going to pass it over to Anna, who's going to talk a little bit about how we can go into the next part of learning from these incredible experts, our Q&A. Do you want
What a great panel. Thank you so much, everyone, and Stephen for facilitating that. I want to share that we are going to leave this webinar in a couple of minutes and go over to a Zoom meeting link, again, so that we can see each other if we want, and we can come off and ask our questions on the microphone. Before we close out, I want to, and the team will drop that link for the Zoom meeting in the chat. But before we close out, I also want to share this resource with you all that was done a couple of years ago. And it's a funding toolkit that kind of walks you through some of the important elements to have at the ready, not just for federal funding, but for other funding opportunities. And it also talks about how to create one of those memorandum of understanding that Shelley mentioned. On the next slide, you will see that we are having a webinar next month, and it's an improving food security for the families, and that will be facilitated by our subject matter experts at the Food Research and Action Center. And then finally, please stay connected with us. As I mentioned, we can respond to individual requests for assistance free of charge. There's a link to that. sign up for our month. We will sign you up for our monthly newsletter unless you tell us that you don't want to sign up for our monthly newsletter, but that will happen automatically. And then please follow the network on LinkedIn. We do weekly posts and try to keep folks connected on all things happening that are kinship at the national level at least, but also feature things that are going on at the state level and the community level. So we are going to share a survey with you in the link. If you can provide your feedback for us, because we want to provide you the most relevant and useful content to improve your services and supports for kinship families. And so we ask questions about that. And then the Q&A link is in the chat. So what we'll do is we'll keep this webinar open for a moment so you don't have to panic about clicking on the Zoom meeting link immediately. But please do join us over there. The panelists are going to go over there now, and we will hope to see you in that forum to ask and go over many of your excellent questions that you've dropped in the chat and that you shared with us beforehand when you registered. So again, thank you all so much for joining us, and thank you, this great panel.